Knock knock. Hello, I'm
Hi.
Ashley. I'm going to be your nursing student today.
Hi,
Can I have your name, please?
Megan Smith,
And your birthday?
1181.
All right, good. We're going to just close the door here to provide privacy. And we're going to be doing a head-to-toe assessment today.
Okay.
To start off here, can I just have you tell me where you are today?
I'm at the clinic, and I'm here for a physical.
Okay, and do you know the day of the week?
Thursday.
Okay, good. So we're going to do the head-to-toe assessment just to look at the body systems and go through just essentially like a physical, as you had said that you were here for.
Okay, great.
First thing we're going to do is do an eye test here. So this is something that you're going to hold in front of your face at about 14 inches away.
Okay.
I want you to cover your eye with this card here. Are you wearing corrective lenses at all?
No.
Okay. So you'll hold this card here 14 inches from your face, and you're going to use this card to cover one of your eyes with. So I'll have you cover one of your eyes.
Okay.
All right, and with the smallest line that you can.
3, 7, 4, 2, 5, 8.
Okay, very good. And then switch.
3, 7, 4, 2, 5, 8.
All right, so vision in both eyes is at 20/20, which is normal, so that is good.
Great.
As far as general appearance goes, patient appears to be stated age, her posture is erect, nutritional status is good, the mood and affect are appropriate, speech is clear, no acute distress or obvious physical deformities. Okay, so we're going to move on to looking at your head and your scalp and neck here.
Okay.
So I'm just going to look at your scalp. Okay, and do you have any obvious tenderness anywhere on your head at all?
No.
Okay, so the head is normocephalic. As I stated before, posture is erect. The scalp is mobile and pink. No masses, lesions that are real obvious. No tenderness is stated. Just going to continue with looking at your head and your neck here. Can I have you smile for me and frown? Puff your cheeks out. Okay, so facial symmetry is equal. I'm going to have you look up for me, look down, side to side, and then tilt your head to the side as well. Cervical range of motion is within normal limits, and trachea is at the midline. I'm going to just do a couple of different palpations, so I'm going to feel your temporal arteries. Temporal pulses are present. Any pain or tenderness?
No.
Okay. And then I'm going to feel your temporomandibular joint. Can I have you open, close, and move your mouth side to side? Okay, good. So temporomandibular joint moves freely and equally. I'm also going to palpate your frontal and maxillary sinuses. Any pain or tenderness there?
No.
Okay. So no pain or tenderness with sinus palpation. And then I'm also going to palpate your lymph nodes. Any pain or tenderness with lymph node palpation?
No.
Okay. So no palpable lymph nodes and no pain or tenderness, so that is good.
Okay.
All right, so moving on to testing the shoulder strength as well in cranial nerve 11. I'm going to have you raise your shoulders for me. Don't let me push down. Okay, I'm going to have you turn your head to the side. Don't let me pull your head back, and then look the other way, and don't let me pull your head back. Okay, good. So head and neck are within normal limits, so that is good.
Okay.
Now we're going to move to the eyes. So we did the test, the Snellen test that came back at 20/20 for both of your eyes, so that is normal. First thing I'm going to have you do is cover one of your eyes. We'll use this card again. All right, that works too. And I'm going to have you tell me when you see my object come into your vision.
No.
Okay? And cover the other eye. And again.
No.
Okay, good. So your visual fields are in an appropriate position. I'm going to have you focus at my pen here, and then look at the wall behind me, or straight back, and then focus at my pen again. So accommodation is appropriate with the pupils. Pupils are about 3 millimeters in size, which is normal. Now I'm going to have you follow my pen with your eyes. Don't move your head. So your fields of gaze are appropriate as well, so that is good. I am also going to shine a light. I want you just to stare at the wall behind me here.
Okay.
I'm going to shine a light on the bridge of your nose. Corneal light reflex is symmetric in both eyes, so that is a good test as well. And then I'm going to check your pupils to make sure they're reactive to light too. So I'm going to have you stare straight ahead for me again. Okay, so pupils are round, equal round, reactive to light, and accommodation, so that is good. Last thing I'll do for the eye portion of the test is do the external examination just to make sure that your eyes are normal as far as appearance. It doesn't look like you have any additional redness or anything. I'm going to have you look straight up for me. Okay, then look down. Okay, and blink. So no evidence of any lid lag, which is normal. Sclera and the sclera on both of your eyes is white, conjunctiva is pink and moist. No evidence of any extra drainage or bleeding. The iris and the retina are both equal and normal in color, so that is good.
Okay.
And then I'm going to do a test where I look inside your eye, so I'll have you stare straight ahead for me again. Check your other eye as well. All right, so red light reflex is present in both eyes.
Okay.
The optic discs are yellow, yellowish orange in color. Vessels are present, not crossing. The vessels weren't crossing, and then everything on the inside of the eye checked out to be good as well. So that is good.
Okay.
Okay, so next we are going to move on to the ears. The external ears are appropriate. They are connected at less than 10 degrees, which is good. They are symmetric and they are at the appropriate levels compared to your eyes. No obvious masses or lesions, so that is good. I am going to just feel the outside of your ears. Any pain or tenderness?
No.
Okay. We're going to do just a couple of series of hearing tests. So I'm going to have you turn and face that way for me. I'm going to cover one of your ears. I'm going to whisper something, and I just want you to tell me, repeat back what you hear.
ABC.
Cover your other ear.
1, 2, 3.
That is correct. So that is a passing whisper test. Next thing I'm going to do is place a tuning fork on the top of your head. I want you to let me know if you hear it in the right, the left ear, or in both equally.
Okay. I can hear it in both equally.
Okay, good. So that is a positive Weber test. The next test I'm going to do is the Rinne test. So I'm going to place a tuning fork behind your ear. I want you to let me know when you don't hear the sound anymore. And then I'm going to put it next to your ear, and I want you to let me know when you don't hear the sound anymore.
Okay. Yeah, it's not enough. No.
Okay, so air conduction is greater than bone conduction, which is a normal test.
Okay.
Okay, so moving on to the internal ear exam. I'm going to have you look to that corner for me. Okay, so the inside of the ear does not have any exudate present. There's no swelling, redness, or drainage noted in the ear. The eardrum is pearly gray and no perforations are seen, and your landmarks are visible, so that's normal.
Okay, great.
We'll look in the other ear too. We look to that corner. And same for that ear, so that is normal.
Okay, great.
All right. So now we are going to do the nose portion of the test here. I'll have you just stare straight ahead here. Nose is at the midline of the face, no obvious deviations of the nose, so that is good. I'm going to look in the nose here, and I did change the speculum to a different applicator. So if you just look up for me. Okay, and I'm going to look on the other side as well. Okay, good. So the nasal mucosa is pink and moist. Turbinates are consistent with the mucosa, which is good. There's no obvious perforations or deviations inside the nose, so that all looks good as far as the septum and everything goes.
Okay, great.
All right, so next thing I'm going to have you do is close your eyes for me. I want you to cover one of your nostrils, and I want you to tell me what you smell.
Coffee.
Okay, and I'll have you switch to the other side. Same thing, tell me what you smell.
Coffee.
Okay, good. So your smell test is passed. Last thing I'll do for the nose is I'm going to have you cover one of your nostrils and blow out for me. And the other side. All right. So nostril patency is clear as well. So that's good. Okay. Where'd that kid go? All right, so now we're going to look in your mouth. Just needed to grab a tongue depressor real quick.
Okay.
So you open your mouth for me. Okay, so mouth, the gingiva, the oral mucosa, the teeth are all in good shape. The oral mucosa is moist and pink in color. Palate is intact. Tonsils are 1+, and the uvula is also present in the throat. So I'll have you open your mouth again and say ah. Okay, uvula rises symmetric, and then with your mouth closed, just stick out your tongue for me. So tongue is equal in symmetry, no cracks, pink in color, and moist. So that is also appropriate. All right. So now we're going to move to the back. So I'll have you just kind of turn your body for me. Okay, so just looking at the skin on the back's color is consistent with the rest of the body, warm to the touch on both sides, so warmth is symmetrical. Skin turgor is appropriate, no dehydration is noted. As far as the back appears, it is symmetrical. I'm going to just feel your thyroid. Have you swallow for me? So thyroid is not palpable, that is good. I'm going to have you, I'm going to do what's called symmetric expansion. So I'm going to have you take a deep breath in for me, and out, and in, and out. Okay, symmetric expansion is equal on your back. I'm also going to do a test that's called tactile fremitus. So every time I move my hands, you're going to say the phrase 99. Okay, go ahead.
99, 99, 99, and 99.
Okay, tactile fremitus is equal on both sides and present in all fields. So that is good. All right, so next thing I'm going to do is to percuss your lungs here. So I'm going to do a little tapping on your back. Okay, so resonant lung sounds were present in all fields, so that is normal. I'm also going to listen to your lungs. Take a deep breath in, and out, in, and out, in, out, in, out, in, out, in, out, and good. Lung sounds are clear in all fields, so that is normal and good. No evidence of any crackles, rails, or wheezing, so that is appropriate. Okay. In regards to the back, that all tested out to be normal. Also, last thing I'm going to do is just check the alignment of your spine. Do you have any tenderness So your spine alignment is appropriately aligned, and you have no tenderness or lumps that I can tell.
Okay.
Okay. So we will move on to the chest. So first thing I'm going to do is just look at the symmetry of the chest. It appears to be equal. Arms are also equal. Respirations are equal. No obvious use of accessory muscles, and respirations are not labored. So that is good.
Okay.
We are going to do the tactile firm test again, where I place my hands. This time I'm going to use the small side of my hands.
Okay.
So I'll have you say 99.
99. 99. 99. 99.
All right, good. So that test came back within normal limits. The tactile firm test was equal on both sides.
Okay.
I'm also going to feel the lymph nodes right above your clavicle and then underneath your arms. So have you lift your arms out for me? Any tenderness?
No.
Okay, so no positive lymph nodes, no tenderness, or any obvious lumps. We will listen to the carotid bruit if there's anything present there. I'm going to place my stethoscope on your neck here. No carotid bruit present, so that is good. Just going to feel the carotid. Okay, carotid is present on both sides. Also going to listen to the apical pulse for a full minute, and we'll check the regular rate and rhythm of your heart too.
Okay.
Heart rate is at 72 beats per minute and at regular rate and rhythm, no obvious murmurs or gallops. I will have you lean forward a little bit for me too. Okay, and no murmur was heard with you leaning forward with the small side of the stethoscope, so that is good.
Okay.
We'll also do the listening to your heart sound, so I'm going to move my stethoscope in 5 different positions. I'm going to do it with the larger side of the stethoscope first, and then we'll do the small side of the stethoscope.
Okay.
Okay, heart sounds are regular in rate and rhythm in all of the different heart fields, so that is good.
Great.
I'm also going to feel for the apical impulse here. And that is present. I'm going to have you lean back at about 30 degrees, the head of bed at 30 degrees here, and we're going to check for any jugular vein distension. Do that by shining the light from the back side. And no jugular vein distension is present, so you can go ahead and sit up.
Okay.
And then I will also listen to the breath sounds on the front as well.
Okay.
Okay, so take a deep breath in, out, Good, so breath sounds are clear on that side as well.
Okay.
One test we are going to do is check the height of your diaphragm, so I'm going to have you turn as well. And what I'm going to do is do the same tapping on your back, but I'm going to measure to see how high your diaphragm raise is. So I'm going to have you take a deep breath in and hold it. Okay, just going to mark a little line on your shirt here so I can measure. And then blow out, breathe regular for a minute. Okay, then take a deep breath in and let it all out. Alright, I'm going to put another line on your shirt here. Diaphragmatic excursion is at 3 centimeters, so that is normal.
Okay.
All right, so next I'm going to have you lie back. We'll check your abdomen. Okay, so abdomen is flat. There's no obvious masses or pulsations present. Umbilicus is at the midline, so that is normal. I don't see anything obvious as far as any lesions. Do you have any tenderness at all in the
No.
abdomen? Okay, good. So that inspection comes back normal. I am going to listen to your bowel sounds.
Okay.
Okay, bowel sounds are present in all 4 quadrants. If they were not present in any of the quadrants, I would have listened for a full 5 minutes until I was able to determine if there was no sounds present. So
Okay.
that checked out good. I am going to also listen to the aorta on your abdomen too to hear if there's any bruise there. Okay. Do that with the small side of my stethoscope. No bruise present, so that is normal. I'm also going to palpate that aorta. I'm feeling for the pulsation. Okay, and the aorta is measuring at about 2 centimeters, so that is normal. Okay, now I'm going to palpate or feel the abdomen. I'm going to use a gentle pressure just to get a feel for the abdomen and then do a more deep palpation as the second time. Do you have any tenderness at all that you know of?
No.
Okay, so just a little pressure on the abdomen. Okay, then we'll do a deep pressure. Okay, so no obvious masses or anything, no stated tenderness or no lumps that were present during palpation.
Okay.
I am also going to feel for your liver, spleen, and your kidneys. So I'm going to reach my hand around your back here and press down. Can I have you take a deep breath in and out? Okay, your liver is not palpable. And same thing on this side. Take a deep breath in for me. And out. Okay. So liver and spleen are non-palpable, and kidney, breathe in and out. Good. And again. Okay. All right, good. Well, I'm also going to percuss for the liver height. So I'm going to do a tapping on your abdomen to start with. I'm going to put a mark here. And we'll do it again to see where the top is. And I'm just listening for an area of dullness. mark here. I'm gonna measure that. Okay, so your liver height is at 7 centimeters, so that is normal.
Okay.
Okay, now I'm going to percuss the rest of your abdomen here. Okay, so Tiffany is present in all 4 quadrants, so that is normal.
Okay.
Next thing we're going to do is just feel for the femoral lymph nodes, which is down kind of in the groin area.
Okay.
Femoral pulses are present. Any pain or tenderness in the lymph node area in
No.
the groin?
No.
Okay, so I'd palpate for both the horizontal and vertical chains of the inguinal region. So that came back normal as well.
Okay.
That's good. You can go ahead and sit up. We are going to do your upper and lower extremities here.
Okay.
So first of all, looking at the arms, the color on the arms, shirt-wise, everything looks good. Skin is pink in color, consistent with the rest of the body. Skin is warm to the touch and equal on both sides. Radial pulses are present and equal on both sides. Brachial pulses, you can rest your arms right on your legs there, are present, and also in the upper portion of the arm are present and equal. You can see your hands here. Capillary reflex is all less than 3 seconds in all fingers, so that is normal, and fingers are properly aligned for the hands. Okay, we are going to test your range of motion for your arms. So I'm going to have you bring your arms up above your head and down, then out to the side and back in front of you. Then I'll have you bring your arms up and then back down, and then up again and down to a half. I'll have you flip your hands over. You'll spread your fingers out, in, wrists up, down, and turning in. We're also going to test your strength, so I'm going to have you bring your arms out to the side. Don't let me push down, and don't let me pull up. I'll have you bring your arms up and do a fist again. Don't let me pull against you or push against you. So that's good. Fingers out in front of you. Going to test the finger strength. Okay, so that is good, and then I'll have you squeeze my hands as well. Okay, so hand strength is equal on both sides. Range of motion and muscle strength are appropriate, so that is good as well. Also, the pulses and everything were normal on that too. Okay, we are going to do the neuro assessment on both the upper and lower extremities. So first thing I'm going to have you do is close your eyes. I'm going to have you turn a palm up for me. I'm going to write a number in your hand. 6. Yes, that's correct. I'm also going to place an object in your hand, 2. Go ahead and grab the object. Can you tell me what that is?
A pen light.
Yes, that is correct. And you can open your eyes for the time being. We're going to do a couple of different tests where I'm going to touch you with an object. It's going to be a paper clip here.
Do I keep my eyes closed?
It will have you close your eyes, yeah,
Okay.
in just a second here. But I'm going to touch you in different areas on the upper and lower extremities, and I just want you to say now when you feel the poke from the paper clip, okay?
Okay.
All right, go ahead and close your eyes.
Now. 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 Now.
Okay, good. So you passed the pain reflex. Now we're going to do the soft touch reflex. So I'm going to place a cotton ball. Same concept, just let me know when you feel a soft touch.
Now. 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 Now.
Okay, good.
Okay.
We'll also do the same thing, but with the vibration.
Okay. Yes. 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 Yes.
So all of your pain, light touch, and vibration senses came back normal, so that
Okay.
is good.
Great.
We'll also test your reflexes.
Okay.
I'm going to have you just relax your arm as much as you can for me. We'll test the brachioradialis. Okay, so that was present. Okay, so bicep was present as well. And tricep was also present. We'll do it on this wrist too. Okay, so brachioradial was present. Bicep was present. And tricep was present. Now we'll do it on your legs. Have you scoop back just a little bit maybe. Okay? Try to relax your leg as much as you can. Okay, so the patellar is present. Patellar is present on this side as well. We'll do the ankle reflex. And that is present. Okay, and then we'll also do the plantar. And that is present with the toe raise. Okay, good. Reflexes are equal on all sides.
Okay, great.
All right, so now we're going to do the lower extremities. Looking at legs, they appear equal. Skin on the legs is appropriate as far as color goes. I'm just going to roll hands up a little bit. Warmth on the legs is equal. Color is also equal and consistent with the rest of the body. No edema is present on the legs. In between the toes, toes are equal, in proper alignment. Skin in between the toes is normal. Toes are also warm as well. So I'm going to feel for your popliteal pulse. And those are present and equal. Tibial pulses are present and equal. Dorsalis pedis pulses are also present and equal. Good, so that is normal. We'll have you do some lower extremity range of motion here.
Okay.
So I'm going to have you lift one leg up towards your chest and down, the other leg too. Okay, and then knees in and out. Okay, good. Hip range of motion is appropriate. I'll have you bring your knee out and then back down, other leg. Okay, and then have you do the ankle up and down. Good, another side. And then toes open and closed. All right, good. So range of motion is appropriate on your hips, your knees, ankles, and feet. I'm going to have you bring your knee up towards your chest. Okay, push against. And then don't let me pull up. Okay, good. Same thing. Don't let me push down. Don't let me pull up. Good. And then I'm going to have you push your legs against my hands. So bring your knees up this way. Leg straight. There you go. And then push against. And then the other leg too. Good. All right. So your muscle strength on your hips and your knees is appropriate. And then last thing we'll do is feet. So I'm going to have you bring your toes up. And then I'm going to have you pull them down. All right, good. So that is normal as well.
Okay.
So last thing I'm going to have you do is just a couple of muscle tests to determine your walking and things like that.
Okay.
So I'll have you stand up, have you walk across the room just normal. Okay, turn back and walk heel to toe. And I'll have you actually put your heel to your toe just like this.
Okay.
And I'll have you, at the end of the rug, turn back and walk on your tippy toes. All right, and then back on your heels. Good. So your musculoskeletal test is appropriate.
Okay.
I'm going to have you stand straight up here and close your eyes. What I'm looking for is any swaying. And you're not swaying, so that's a negative Ronberg test, which is good. I'm also going to have you touch your toes to check your spinal alignment and your range of motion with your spine. Spinal alignment is normal and range of motion is appropriate. And then the last thing I'll have you do is just a shallow knee bend there. All right, and that is appropriate as well.
Okay, great.
So as far as your head to toe assessment goes, everything checked out normal, so that is a good result. Do you have any questions at all?
I don't think so.
All right, sounds good. Well, it was nice working with you today.
Great, thank you.
Thank you.